Welcome to the lecture on gels. We will begin this lecture with both a simple and a more detailed definition of a gel. Simply stated, a gel is a dispersion of small inorganic particles or a solution of large organic molecules rendered in a jelly-like consistency. A gel has a thick, viscous feel to it. To understand gels more completely, a detailed definition describes them as a semi-solid system consisting either of small inorganic particles or large organic molecules in which the particles restrict the movement of the dispersing medium by forming an interlacing three-dimensional network of particles or sulfated macromolecules. So essentially, this thick consistency is created by the interlacing and three-dimensional network of particles, which increases the viscosity of the final product. Therefore, to create a gel, we must use gelling agents, which are particles that have this property. Gelling agents are substances which undergo extensive cross-linking or entanglement when dissolved or dispersed in a liquid, meaning they create three-dimensional lattice work and by cross-linking between particles, increase viscosity of the product. As such, you will notice that when we discuss specific gelling agents, many of them are the same agents used for increasing viscosity for other dosage forms such as suspensions. Here we describe some of the uses and desired properties of compounded topical gel products. There are three main reasons to use a gel topically. The first is to protect skin or mucous membranes from chemical or physical irritants in the environment, and thereby allow the rejuvenation of that tissue. The second use would be to provide hydration to the skin by having an emollient effect. The third reason to use a gel is simply to act as a vehicle for delivering a drug for either local effect, such as if we were to compound a topical antibiotic, or for systemic absorption, such as a nitroglycerin gel. Since gels are used for both local and systemic administration of drugs, their applications are wide and varied. Gel products have been compounded for oral use within the oral mucosa. Gels are also used topically on the skin, vaginally, rectally, and even within the nasal passages. So gels provide a flexible dosage form when we want to apply or administer a medication in a variety of ways. As far as the desired properties of our final product, in general, we would like to be able to have our final gel be clear, water washable, water absorbing, as well as feel greaseless to the skin. Gel formulations are clear when all of the particles dissolve completely within the dispersing medium. However, this may not occur in all gels, and therefore some of them have a more turbid appearance, such as the PLO gel we will describe in detail later. This slide describes properties inherent in extemporaneously compounded gels. The first property is that gels exist in either one of two phases. Either the gel is a one-phase system, which occurs when there is no distinct particles present in the final product, meaning the macromolecules that are used to create the gel or the three-dimensional lattice work are completely dissolved or dispersed within the medium and are not visible. One-phase gel systems are very commonly used. Examples of macromolecules used to create one-phase systems include the natural polymers such as acacia, or the semi-synthetic cellulose derivatives, including methylcellulose, or synthetic polymers such as Carbomer. Gels can also exist as two-phase systems. A two-phase system occurs when we can see distinct particles dispersed within the final gel. Two-phase systems are sometimes referred to as thixotropic, meaning they are semi-solid on standing, but liquefy when shaken. An example of a two-phase gel would be the commercial product for milk of magnesia or aluminum hydroxide gel. Another way to classify gels is by their composition. Here, the classification is either as a hydrogel or an organogel. Hydrogels are one-phase systems which contain active ingredients that have been dissolved in either water or alcohol or both, and to which an organic gelling agent such as Carbomer or Poloxamer has been added. The other classification is as an organogel. Organogels are two-phase systems where a one-phase gel or hydrogel is combined with a hydrocarbon base. The mixing of a hydrogel and a hydrocarbon base forms a microemulsion, which is a two-phase system because the particles are visible within the gel, which is now cloudy or turbid. in contrast to hydrogels, which are typically clear. A commonly used organogel is called PLO gel, which stands for Pluronic Lecithin Organogel, and is a combination of a hydrogel with an organic base called LIPS, LIPS, which stands for lecithin isopropyl palmitate solution. Two-phase system gels, or microemulsions, are frequently used when the gel is to be used transdermally on the skin, because the organic phase of the organogel will increase the dermal penetration and absorption of the drug. To summarize, gels are classified either as hydrogels, when they only contain water, alcohol, and gelling agents, or as organogels, when the hydrogel has been combined with an additional hydrocarbon base. The three main classes of gelling agents used are the cellulose derivatives, the Carbomers, and the Poloxamers. Before going into detail individually, there are 6 generalizations that can be made about all gelling agents. The first generalization is that if the gelling agent is added to the dispersing medium too rapidly, or haphazardly, the agents tend to clump. The outer molecules of the gelling agent actually contact the medium first and hydrate. By doing this, they form a layer with a gelled surface. That in turn makes it more difficult for the medium to continue to penetrate into the powder. Compounding techniques can be used to minimize this problem. First, sift the powder slowly into the vortex of a rapidly stirring medium. Second, levigate the powder with a water-miscible non-solvent such as absolute alcohol or propylene glycol. Third, use a blender with a lot of energy to mix the powder into the solvents. All 3 techniques can be used to get the gelling agent to not clump as we liquefy it. The second generalization is that the solubility of some gelling agents is affected by water temperature. For example, we would want to use cold water for methylcellulose and poloxamers, tepid water for carbomers and terganthins, and hot water for gelatin and sodium carboxymethylcellulose. The third generalization is that some gelling agents, especially carbomers, may require pH adjusting to create the gel after they've been wetted and dispersed. These agents are actually thin and fluid when first compounded and require the pH to be raised before they begin to gel. The fourth generalization is that most gelling agents require at least 24 to 48 hours to completely hydrate and thereby reach their maximum viscosity and clarity. The fifth generalization is that most gelling agents are commonly used require concentrations ranging from 0.5% up to 2%, although there are some exceptions with ranges as high as 10%, but that would be uncommon. The sixth and last generalization is that adding the drug while creating the gel is much easier than trying to add the drug to the gel after it is formed. Because the final gel is thick and viscous, it would be very difficult to disperse a solid or liquid drug into the gel once it has already formed. The first class of gelling agents to discuss in more detail are the cellulose derivatives. Cellulose derivatives are the gold standard because they have been used for a long time. However, recently their use has declined with the availability of new agents such as Carbomers and Poloxamers. Nevertheless, they are still considered very effective and produce clear, thick gels, which maintain their viscosity over a wide pH range. The class of cellulose derivatives is made up of individual agents, which I give 3 examples on this slide. The first example, which is the prototype of the whole group, is methylcellulose. More specifically, for creating topical gels using methylcellulose at 1500 centipoise. This type of methylcellulose is useful because it makes thinner gels than other cellulose derivatives and has a high tolerance, which means it maintains its viscosity over a wide pH range. Methylcellulose is compatible with water as well as alcohol up to 70% and propylene glycol. However, liquefying methylcellulose is difficult and requires that you begin by carefully adding it by sifting to 1/3 of the total volume heated to near boiling, and then quickly bringing down the temperature by adding cold water or ice chips until you reach the final desired volume. So, methylcellulose is technically challenging to compound with. A derivative of methylcellulose includes hydroxypropylcellulose, which is a good alternative to methylcellulose if a 15% or more organic solvent is needed to dissolve the active drug. So, hydroxypropylcellulose is an alternative that can be used if you have a high degree of hydrocarbon organic base that needs to be incorporated. Another example would be hydroxypropyl methylcellulose, which has been used by some pharmacists for compounding time-released formulations. So, I have described 3 cellulose derivatives that have been used historically to compound gels. However, due to their time-consuming technical compounding requirements, they have been replaced by newer, more easy-to-use agents. The second class of gelling agents to discuss are the carbomers. The word carbomer is a generic name for the carbopol family of resins. Carbomers are dry powders. Initially, they come as fluffy white powder. The powder forms a slightly acidic solution when dissolved, with the pH of the solution close to 3. The solution thickens as you raise the pH closer to a neutral pH, especially around 5 or 6, which is useful for many drugs. At the desired pH, carbomer solutions start to thicken and swell in size, and actually in some cases can become as much as 1,000 times the original volume. Carbomers are primarily used in aqueous and hydroalcoholic solutions such as hydrogels. However, their preparation can be challenging. You must slowly disperse the carbomer powder in either water or alcohol to avoid clumps. You must take advantage of small particle size by sifting carbomer powder into the vortex of a liquid which is stirring very rapidly. Again, while carbomer preparation can be somewhat of a challenge to prepare, the advantage is that it produces very appealing, sparkling clear gels. Carbopol is available as different resin forms. In Pharmacy Skills Lab, we commonly use Carbopol 940 because it is effective at creating hydrogels that are thick and have good clarity. Alternatively, Carbopol 934P, where the P stands for a highly purified product, permits its use by pharmaceutical manufacturers in the production of various formulations, including commercial emulsions, suspensions, and is often used in sustained release formulations such as transdermal patches and other topical gels. The third and last category of gelling agents to discuss are the Poloxamers. Poloxamer is the generic name for the registered brand name product Pluronic. Poloxamers are actually copolymers of polyoxyethylene and polyoxypropylene. Poloxamer is composed of white, waxy, free-flowing granules that can be mixed with very cold, purified water to perform a liquid gel formation. A significant advantage to using Poloxamer is that a 20% solution called Pluronic F127 is commercially available as a pre-prepared liquid. This means you can obtain the Poloxamer liquid gel already prepared, which in turn significantly reduces the amount of time and effort necessary to compound gels. So remember, when I refer to using Pluronic or Pluronic F127, I am using the commercially prepared 20% Poloxamer solution. Another important fact about using Poloxamers is that they form thermal reversible gels in concentrations ranging from 15 to 50%. A thermal reversible gel means the product is a liquid when at cold or refrigerated temperatures, but form a gel with increased and thick viscosity at room or body temperature. Therefore, the commercial product Pluronic F127 must be stored in the refrigerator to keep it as a liquid. As a liquid, it can be measured using a syringe or volumetric glassware. Then, as it is used during the compounding procedure, energy in the form of mixing and shearing is provided that will warm the Pluronic solution, causing it to thicken and gel. The most common use of Poloxamer as a gelling agent is when it is used in combination with a hydrocarbon phase to create an organogel. So Poloxamer is used to create the aqueous hydrogel component of the commonly used organogel product referred to as PLO gel. And I'll remind you, PLO stands for Pluronic Lecithin Organogel, where the P is the Poloxamer, which acts as the aqueous or hydrogel component, and where L is the oil phase component called lecithin isopropyl palmitate solution, commonly abbreviated as LIPS, L-I-P-S, and where O stands for organogel. So PLO is Pluronic Lecithin Organogel. Now, LIPS, or LIPS, is the oil phase or the hydrocarbon phase that is often used when creating topical gels. This is because the lecithin component acts as a skin modifier, and the isopropyl palmitate solution acts as an absorption enhancer. So by adding LIPS to our pluronic phase, which normally contains our water-soluble drugs, we can soften up the skin and increase drug absorption. To create a PLO gel, we typically use the commercial product Pluronic F127 combined with lip solution in a ratio of 3 or 4 to 1, meaning use 3 or 4 parts of Pluronic F127 to 1 part lip solution. Alternatively, take the total volume to compound and multiply by 20 to 25% to determine the volume of lips to use. The reason I give the range of values is because I have seen PLO formulations that call for 20, 22.5, or even 25% of the volume to be lips, with the remaining volume to be the combination of drug and pluronic. Combining a drug, Pluronic F127, and lips together in the correct amounts and using the correct procedure that I will describe next creates a PLO gel. There are multiple methods used for compounding a PLO gel. This slide illustrates the method whereby a primary gel is formed first and then used to wet and incorporate solid ingredients. Begin by looking at the picture on the top left, which illustrates the two components. The beaker on the left with the orange oily looking solution is lips, LIPS, or lecithin isopropyl palmitate solution. Remember that we use 20 to 25% of our total volume as lips. The beaker on the right contains Pluronic F127, which is a clear solution and would have the remaining 75 to 80% of the total volume. There is a little bit of condensation on the Pluronic beaker because the solution is cold. We just removed it from the refrigerator. Remember, Pluronic is a liquid when it is cold, but thickens up when it is warmed. The picture on the top right shows that we begin by adding all of the lips to the Pluronic solution. Then, as shown in the lower left picture, the two solutions are mixed vigorously with a stirring rod for several minutes to form the primary gel. A lot of energy in the form of prolonged, vigorous mixing will warm the mixture and promote the formation of the thermoreversible gel. The liquid that forms has the consistency and color of thick, melted butter. Once the primary PLO gel has formed, it can be used to wet and incorporate solids as illustrated in the picture on the lower right. Once all of the solids have been incorporated and thoroughly mixed, the gel can be transferred to a final dispensing container. There is an alternative method for compounding PLO gels and involves the use of syringes and syringe-to-syringe connectors, and is used when you need to compound relatively small volumes or you want to be able to minimize loss or waste. In this procedure, the active drug is solubilized in a minimum amount of either water or alcohol and drawn up into a syringe. The drug solution is then transferred to a second syringe containing Pluronic F127 by using a syringe connector to form the hydrogel. The hydrogel containing syringe is then connected to a syringe containing lips, LIPS. If the drug is lipid soluble, then it can be solubilized directly in the lips solution first. Keeping the two syringes connected, the mixture is passed back and forth between the two syringes. The solution becomes warmed as energy is passed to it from the mechanically being forced back and forth through the narrow opening of the syringe connector, and the PLO gel forms and thickens. Once formed and thoroughly mixed, the PLO gel can either be dispensed in one of the syringes or expelled out into a final dispensing container or device, such as a PCCA AccuPen device. This method of PLO gel formation is illustrated in the video procedure on the next slide.
As a reminder, in the 3 ml syringe, we have our acyclovir lidocaine solution, which are our active ingredients, and in the 12 ml syringe, we have our Poloxamer solution, and this is the aqueous phase. We want to go ahead and add the 3 ml syringe into the 12 ml. So you do this by using a syringe connector. We will attach it to the 3 ml syringe and then attach our 12 ml and lure lock that on to. We now can add the solution into the 12 ml syringe. So gently add that. Go ahead and twist off the 3 ml syringe. And now you're ready to add the lips portion. You're now doing the final step where you're making your PLO gel. So you want to attach the lip solution onto the syringe connector. Remember, you need to be sure that both sides are luer locked on snugly. So check. Now, you can do this two ways. You can go ahead and do it side to side. And you want to rapidly move the solution from one syringe to the other. Or you can use the counter and push it and just rotate it. You will want to check periodically for any dark yellow swirls, because that means that the PLO gel is not uniformly mixed yet. Keep doing this, and I recommend that you if you want to count, it's probably about 50 times, but back and forth. Periodically check and make sure that both sides are still luer locked on. And continue to do this until you have a uniform PLO gel.
This slide summarizes general preparation requirements for compounding gels. To recap the compounding procedures in general, begin by taking the active drug and solubilizing it in whatever solution is most appropriate. Typically it is water, or possibly alcohol, or in some cases, when preparing an organogel, the drug may actually be more soluble in the lips or hydrocarbon base. Regardless, solubilize the active drug first. Then add the gelling agent, whether it is a cellulose agent, a carbomer, or a poloxamer. Next, apply energy and shear forces to get the gelling process to start. Now there are various methods for applying the energy, whether by blending, or by mixing through vigorous trituration, or by forceful transfer between two syringes. Another method even that can be used is placing the gel and active drug in a plastic bag, and then kneading thoroughly to mix the drug. After the preparation is mixed, a corner of the bag can be cut off and the preparation squeezed into a dispensing container. Whatever the method used, it takes energy to form the final gel and get the drug evenly dispersed. Next, we will discuss preparation guidelines for compounding gels. The first guideline is quality assurance. To ensure the quality of the final product, the pharmacist should document on the compounding record the following items. First, the appearance and clarity of the product, meaning whether it is clear or cloudy or turbid in the case of a PLO gel. Its uniformity, final weight or volume dispensed, viscosity, pH, and smell or odor if any. The second preparation guideline is beyond use dating. The USP suggests adding preservatives because gels and the macromolecules used to create the three-dimensional lattice work neither promote nor inhibit bacterial growth. Therefore, to prevent bacterial contamination, preservatives are typically added. Sorbic acid or potassium sorbate at 0.2% weight per volume are two commonly used preservatives. Keep in mind that the addition of some preservatives may make the final gel product actually cloudy instead of clear, and is due to the preservative not being completely dispersed or dissolved within the gel medium. USP Chapter 795 states that in the absence of specific stability information, the beyond use date is not later than 30 days for water-containing topical or dermal or mucosal liquid and semi-solid formulations. The third preparation guideline is about the amount to prepare. USP Chapter 795 states for gels, being semi-solid dosage forms, that due to loss of product during compounding, to prepare an excess amount of the total formulation to allow the prescribed quantity to be accurately dispensed. This is a practical recommendation when using the method of creating a primary gel and using it to wet and disperse solids using a mortar and pestle. With this method, there is loss of product during the compounding, such that calculations and procedures should be based on the preparation of 10% excess. However, when using the syringe method described for compounding a PLO gel, there is very little, if any, loss of product. Often the gel is dispensed in the same syringe or container it was compounded in. In this case, there is no need to compound excess. Calculations and procedures should be based on the preparation of the prescribed amount. The last preparation guidelines to discuss are product packaging and labeling. In terms of packaging, always use tight containers, such as jars, tubes, squeeze bottles, or pump dispensers. Tight containers are important for a couple of reasons, including the need to prevent water in the gel from evaporating, or actually the opposite reason, for gels made using Carbomers are actually quite hygroscopic and could absorb too much water from humidity in the air, especially if stored in the bathroom. As for product labeling, the active ingredient can be indicated as a percent strength, usually weight per volume, such as the example of lidocaine 4%. Alternatively, drug strength can be indicated per dosage amount, such as the example of scopolamine 0.25 milligrams per 0.1 milliliters, where the instructions would be to apply 0.1 milliliters of gel. Next, if the product is a PLO gel, then it should be labeled as such. This is because the LIPS or LIPS ingredient in a PLO gel has therapeutic effects, including softening the skin and enhancing drug absorption. There should also be an indication of the route the gel is to be used, typically being topical, but could also be rectal or vaginal. For example, a PLO gel after the drug name and strength on the label would read, in PLO topical gel. There are also a couple of very important auxiliary labels that should be applied to most compounded gels. Since many gels are intended for topical use, they should include the auxiliary label for external use only. Auxiliary labels indicating how to store the product, especially important for thermal-reversible gels, such as PLO gels. It is critical that PLO gels are stored at room temperature and are not refrigerated, or they will liquefy. It is prudent to always indicate to store gels at room temperature.